Welcome to our next session. This is called Under the Dome. We've been doing this at AAKP for about the past 7 years. And the purpose of Under the Dome is to bring together some of the top lobbyists and government affairs professionals in Washington, D.C. to break down certain issues that are going on in the U.S. Congress, either currently or issues that are building a broader constituency and congressional consensus. We found this session very informative, not only for our own planning, but for many of our activists around the country. This is a fun session, and it gives you some of the practical knowledge that you need in order to be able to do regular congressional contacts, participate in congressional days, and those types of things in the months to come. We always have a great lineup of speakers, and that's no different this year. Really a very good bunch of friends and folks that work with us quite closely at AAKP. Our next speaker is Kelly Delmore. And Kelly is a principal at Hooper, Lundy, and Bookman, a major law firm here in Washington, D.C. that focuses on specialty issues like hospitals, insurance companies, and issues like cancer and kidney disease. She's a principal at the firm. She was named in 2021 as one of the top lobbyists in Washington, D.C., and she's particularly known to us as the lead person for the nonprofit Kidney Care Alliance, which covers organizations that you know well, like DCI. So Kelly's going to break down an issue for us that we've been working on together for the past several years, which is dental care in regard to kidney patients and benefits that could be extended to them. Any patient who's ever been on dialysis or has been put on a waiting list for transplant knows that you must maintain your dental health. And dental health has other implications for patients, including heart issues. So Kelly's going to go ahead and walk through this issue. This is an issue that we feel quite strongly about at AAKP, that we will be able to bring forward in 2023 and 2024 to get a better consensus in the Congress for it, and hopefully extend additional benefits so that we have greater care for patients who are on dialysis, who are CKD, or those who are waiting for transplant. So Kelly, go right ahead. Thank you very much.
Good morning. I'm Kelly Delmore, and I'm honored to be speaking today at AAKP's 5th Annual Policy Summit about the importance of dental coverage as it relates to overall health, but especially in patients with kidney disease. I've attended the past summits both in person and virtually on behalf of nonprofit Kidney Care Alliance, and I've always learned a lot from the presenters and attendees at this conference. It was at this meeting in 2019 when I brought up a question to AAKP members about the importance of dental care, which allowed me to start an advocacy campaign to educate policymakers on why dental is important to kidney patients. In this session, I'm going to cover the importance of dental care, legislative options we had this Congress, regulatory actions and avenues, and lastly, the challenges of moving dental coverage bills forward. Dental benefits are not generally covered by Medicare, except under limited circumstances, and as you can see on this slide, almost half of all Medicare beneficiaries do not have dental coverage. Some Medicare beneficiaries have access to dental coverage through other sources, such as Medicare Advantage plans, but the scope of dental benefits when covered varies widely and is often quite limited, which can result in high out-of-pocket costs among those with serious dental needs or financial hardship. Lack of dental care can worsen chronic medical conditions such as diabetes and cardiovascular disease, contribute to delayed diagnosis of serious medical conditions, and lead to preventable complications that sometimes result in costly emergency room visits. Limited or no dental coverage and cost concerns contribute to individuals foregoing routine and other dental procedures. Oral health is closely tied to overall health, and routine dental care is critical for transplant patients before and after surgery. For chronic kidney disease patients wanting a preemptive transplant, oral health complications and inflammation make it critical that patients receive dental care prior to seeking an organ donor. Without proper oral hygiene, transplants are delayed. In fact, you must have good oral hygiene to be active on a transplant list. In addition, medications used to prevent organ rejection weaken the immune system. A common periodontal infection may lead to much broader health complications when left untreated on a transplant patient. There's also a health equality factor. In the same way that Black and Hispanic Americans are more likely to suffer from kidney failure or wait longer on transplant lists than their white counterparts, They are also more likely to have periodontal disease and cavities, which inhibit CKD and transplant coverage. Black and Hispanic Americans are also less likely to have dental insurance coverage, which is vital to ensure continued access to oral health treatment. Currently, Medicare only covers the final oral exam before transplant surgery at a hospital. All other dental care for chronic kidney disease patients before the transplant surgery and before they are even accepted onto an organ waitlist must be handled outside of Medicare. Most turn to the private individual market for a standalone dental plan to pair with their health or Medicare coverage. If not addressed, disparities in oral health treatment and coverage will continue to impact transplant care process and disproportionately limit the eligibility of Black and Hispanic Americans to receive transplants because they do not have adequate access to oral health treatment. Now, turning to other conditions, many cancer treatments have side effects that affect a person's mouth, teeth, and salivary glands. Dental and oral side effects can make it difficult to eat, talk, chew, or swallow. However, with proper oral care, patients can lower the risk of these side effects and manage them if they do happen. But that's if they have access to oral care before, during, and after cancer treatment. For years, there's been much research in tying heart health and dental care. However, research has shown the stronger correlation with heart valve replacement. Bacteria in the mouth may trigger endocarditis in people at high risk. And here's what happens. Bacteria found in tooth plaque may multiply and cause gingivitis. When the gums bleed, the bacteria can enter the bloodstream and can infect other parts of the body. In this case of endocarditis, this affects the inner lining of the heart and surfaces of the valves. Once again, this can be prevented with proper oral hygiene and dental care. I talked through these disease-specific dental scenarios not only because they're important, but this is the direction recent policy development is occurring in. It's called medically necessary dental coverage in Medicare. And I will go into greater detail a little later, but wanted to lay the foundation here. Now let's turn to what Congress has attempted to do on expanding dental coverage. As you can see on this slide, and what you will see on my next slide, is that there are many different options on how to provide access to dental care. There was a big push to add dental to Medicare last Congress, and it carried over to this Congress when newly elected President Biden made it one of his priorities. It also included in his initial large domestic policy bill, Build Back Better, which did pass the House, but never passed the Senate due to objections, especially by Senator Joe Manchin. Increasing access to dental care is not straightforward. There are many ways of attempting to do it. As you see here, the Medicare Dental Benefit Act of 2021 is the most straightforward, where it would add dental coverage to the Medicare Part B program. But with this option having been so close to being passed, Congress wanted to play out options. So leadership and committee staff also talked through other scenarios where instead of adding a dental benefit to traditional Medicare Part B, because it costs a lot of money to add it to Part B, instead they could perhaps create a new Medicare benefit like they did with prescription drugs back in 2003 with Medicare Part D. What if they called the new dental Medicare Part T for teeth, and it could be operated similarly to the prescription drug benefit? There was also a lot of discussion around mean testing, where only beneficiaries who qualified for it financially could receive the benefit. Then you also have legislation that only adds medically necessary dental coverage to Medicare. You also have legislation that not only adds dental, but also vision and hearing coverage to traditional Medicare as well. You have other avenues of coverage to consider: Medicaid and the ACA marketplace. On this slide, the first bill listed adds dental, vision, and hearing to both Medicare and Medicaid. You then have the Medicaid Dental Benefit Act of 2021, which would ensure that dental is covered by every state Medicaid plan. And lastly, you have the only bipartisan bill of the bunch, S 4739, the Increasing Access to Dental Insurance Act. As it currently stands, when an individual goes to the federal marketplace, you can only purchase a standalone dental plan if you also buy a medical plan. This bill would allow individuals, whether on Medicare or a private covered medical coverage plan, to purchase a standalone dental plan on a federal exchange. 10 states plus DC with state-based exchanges currently allow individuals to purchase standalone dental plans. Marketplace standalone dental plans also provide access to lower premiums. Premiums on the marketplace are an average of $6 to $10 less per month than plans off the exchange. This represents significant savings for consumers. We've also seen state dental enrollment grow. For example, when New Jersey dental enrollment grew more than 20% when they allowed independent purchase on their state-based exchange. With Republicans probably taking over the House and having another 2 years of a very close Senate, no matter who gains the majority, having bills that gain bipartisan support are very important. There was a substantial move at CMS this summer on dental coverage for chronic kidney patients. In the final physician fee schedule payment rule, CMS announced that they will cover medically necessary dental and Medicare for a segment of patients with certain conditions. Chronic kidney patients on Medicare seeking a transplant are one of them. Starting in 2023, Medicare will cover dental services such as dental examinations, including necessary treatment performed as part of the comprehensive workup prior to organ transplant surgery or prior to cardiac valve replacement or valvuloplasty procedures. In 2024, CMS will finalize Medicare payment for dental services as part of a comprehensive workup prior to the treatment for head and neck cancers. Now, even though CMS talked about it in the proposed rule, they will not finalize payment policy for dental services prior to the initiation of immunosuppressant therapy, joint replacement surgeries, or other surgical procedures. They stated that they need additional time to consider the link between dental services and those covered medical services. Next, we have Medicare Advantage plans. MA plans may provide supplemental benefits that are not covered under traditional Medicare, such as dental, vision, hearing, fitness. In 2021, 94% of MA enrollees in individual plans had access to some dental coverage. 86% of those Medicare enrollees had access to a private plan with more extensive coverage, while 14% had access to preventative coverage only. Preventative dental coverage under MA plans generally includes oral exams, cleanings, x-rays, and sometimes fluoride treatments. More extensive benefits cover a range of services, including fillings, root canals, dentures, dental implants, and oral surgery. Just recently, the Medicare Payment Advisory Commission, known as MedPAC, met to discuss how to standardize a set of 3 or 4 benefits, potentially hearing, vision, and dental services in the MA program, in order to provide a future recommendation to Congress after MedPAC staff found that people have a more challenging time comparing plans when they have a variety of options. Several commissioners said the current system of parsing through benefit offerings to select a dental plan is extremely complex to navigate for Medicare beneficiaries and even for experts. Beneficiaries deserve increased transparency. So with MedPAC now interested, I predict that we'll see legislation next Congress addressing dental in MA plans. We also have the ACA marketplace issue, which I talked about earlier under legislation. Many policy experts believe the CIO has the authority to make this change on their own without Congress passing legislation. But so far, the administration, both under Trump and Biden, have just given excuses and mixed messages back to stakeholders, including AAKP, who signed onto a pass letter with other kidney and transplant advocates. Lastly, both HHS Secretary Javier Becerra and CMS Administrator Chiquita Brooks-LaSure have placed healthcare equality as a top priority. When you look at Medicare beneficiaries by race and gender, a large share of Black and Hispanic women, 64% and 59% respectively, went without a dentist visit in the past year, and white women, who were at 40%. The same pattern exists among men. 74% of Black and 64% of Hispanic men went without seeing a dentist in the past year, compared to 44% of white men. Health status was also correlated with dental care. Nearly 63% of all beneficiaries in fair or poor self-assessed health had a dental visit in the past year, as compared to 41% of beneficiaries in excellent, very good, or good health. So as you can see, this is very much in line with what the administration wishes to address with inequality. In conclusion, I talked about many possible ways to increase access to dental care. And I believe people can agree that having access to dental care is better for your overall health. So what's the holdup? First, cost. As most of us know, in DC, the number one issue is usually always around the dollar figure. The Congressional Budget Office scored adding dental to Medicare Part B at $238 billion over 10 years. Second challenge, understanding the importance. I had meetings with administration officials about allowing individuals to purchase standalone dental plans on a federal marketplace, and they said in their own terms that it wasn't that important and it's not a life and death benefit. That phrase angered me 4 years ago, as I knew I worked with a lot of great kidney policy advocates who had seen individuals not qualify for a transplant due to their poor oral health. Third challenge, being grouped with vision and hearing. For a long time, dental has been coupled with vision and hearing benefits as an orphan child of health coverage, and it's hard for many to unwrap. Even as you look at bills in Congress, there are so many that group the three together. Fourth challenge, competing priorities. As kidney advocates, we have a lot of good policies to fight for each year in the Capitol, and it's hard to prioritize them. Sometimes dental is forgotten in that bigger picture, and we all need to do a better job in making sure we are banging the drum and educating policy makers. Fifth challenge, those policy makers. For example, I had a Hill meeting about kidney disease and dental coverage with a senior staffer recently, and they had everything wrong about Medicare's coverage of dental leading up to her transplantation. She assumed everything was already covered. Education is key, and is an advocacy power we all have. Lastly, the challenge of patient compliance. As this cartoon shows, we are fighting for access to something most individuals do not enjoy and sometimes outright fear. So even if we expand dental coverage, we still may have an issue with patient adherence, but that's a good problem to have compared to where we are now. Once again, thank you so much for having me here today, and I'm hopeful that we will one day all have access to affordable and comprehensive dental care.
I'd like to thank Peggy, Rob, and Kelly for participating in this year's Under the Dome, and we hope that you've appreciated this as well. So throughout our session here during the entire day, you're being equipped with the knowledge you need on issues that are current or emerging so that you can be effective as a patient advocate and as a partner with AAKP. We hope you liked it, and we'll see you again next year for Under the Dome. Thank you.